We hope they're going to be involved in delivering and informing projects and programs in the years to come. Before I hand over to Katy, a few brief thank yous. Thank you first of all to our policymakers. We have a number of people from Islington Council today. We have Help on Your Doorstep and Arts Council England with us today, who'll be feeding into the policy discussions in the second half of the event. Thank you to the brilliant Katy, who's been delivering this project, and to Priyanka for supporting this project. Both of them really made this project happen. And biggest thanks has to go to our community leaders, Charlotte, Cristina, Gamze, Detroy, David, LaToyah, Paul, Maryam, Sasha. Good luck to you all today, and with no further ado, I'm going to stop talking and hand over to Katy.
Thank you so much, Michael, and thank you to everyone who's here today. It's so wonderful to have you. So just a few more bits of introduction and set up before we pass over to the group. I'm Katy, as Michael said. I've had the joy of working with this group since January. And we've been training as facilitators, thinking about how to use these kinds of tools with other communities around Islington and North London. And then when we realized that the pandemic would change our plans of helping other neighbors or creating a play with neighbors in Islington, we integrated building a play into our Zoom meetings as well. So this group has been doing everything. And we want you to, with us, consider this a beginning and a process. So first, as I said, we've been training in facilitation. And this is the first time leading a process like this with all of you, the audience, so you are crucial. And I will be backing up the group, so you might see me pop in and out a little bit. Second, we want to introduce legislative theater in Islington and for all the communities that you're working with wherever you are as a participatory democracy tool that might be useful going forward. And third, these scenes that we made are showing real issues, are all based on real experiences of the group, and they're real challenges that we want to come up with some changes around those challenges today. And we're going to do that all together. And democracy, which we're going to be playing around with today, is messy. I don't know if you, yes, I see Councillor Ward nodding. Absolutely. Democracy is messy. It's messy in a council meeting. It's messy in a parliament. It's messy in a Congress, where I come from. It will be messy today, and so I hope we can revel in that messiness. And it takes a while, but we're also being ambitious, which I believe is what this moment requires. So just so we can practice a little bit of democracy before we start, get a sense of the idea that we're going to be voting or taking a bit of a poll at the end. We're just going to see who's here with us. So you might see, you should see a little poll on your screen. I'm here because I'm passionate about. If you want to pop in an answer, whatever feels like the most applicable answer for you, will get a sense of who's here. I think it's a bit of a trick question, but you know, it's just practice. So great, I see that votes are rolling in. This is kind of like a census, which is also going on right now. Voting is great, censuses are great. All right, wow, this is great. We've got 90% voting already. That would be an amazing, more than 90%. All right, so I am going to end the poll and just share the results. So as I said, this was a little bit of a trick question. Most likely, many of us, 65%, are passionate about two or more of the above, but we also have lots of folks passionate about arts and culture and local politics or participatory democracy and housing and healthcare. So I hope we get to do to touch on some of those things for all of you. And when we get to the end of the afternoon, we will be voting and we will be moving forward some policy ideas. So in order to do that, as Michael said, we're going to hold each other accountable. And we also have some amazing policy makers here with us, people who have influence over and expertise around the issues in the play and are going to help us think about our proposals and help move them forward out of the Zoom room. So just to shout them out and welcome them, we have Councillor Sue Lukes, from Islington Council. If you can give us a wave. Great, there you go. I know we have several screens, so you might have to move through. Councillor Sue Lukes, who is the executive member for community safety. Hope I got that right. Yes, I think so. And we have Councillor Dearmid Ward. Give us a wave. Who's the executive member for housing and development in Islington Council. We have leader of the council, Richard Watts. I think, yeah, Councillor Watts is here with us. Fantastic. And do we have Chief Executive of the Council, Lindsay Roberts? Egan, are you here? Is Lindsay here?
Community partner
Yes.
background.
Yes. Great, great. Oh, there you are. I see you. Fantastic, fantastic. Just scrolling through my screens. And we also have the director of an amazing local charity that works on a lot of the issues you're going to see. Ken Kanu, the director of Help on Your Doorstep. I saw Ken here. Give us a wave. There you go. We'll hear from Ken. And we also have finally Alex James, relationship manager for theater at the Arts Council. Who's going to help us think about some of those issues. Thank you. So we're going to hear from you soon. We're really grateful for you being here. Okay, last thing from me, and then I'll stop, is some notes on tech on Zoom. So we're on Zoom. We're doing something that we would usually do in person on Zoom. So please, if you're not speaking, if you can keep yourself on mute. But when you are speaking, please do come off mute. You can raise your hand if we can't see you, because we do have lots of people here today, using the raise hand function, which is on the bottom right of your screen if you're on a computer. Under reactions, you can use other reactions if you'd want as we go along. Feel free. We will also ask you, if possible, when we're showing the scenes, to turn off your video. So you use stop video, which on my computer screen is on the bottom left, right next to mute. And then we will turn our video back on. When we're not doing the scenes, keep our videos on, because if you can, because it's very, very important for us to engage with each other. If you are having any technical difficulties, please message Priyanka in the chat, or you can just drop something in the chat. Priyanka is Priyanka at Union Chapel. Priyanka is also, as Michael said, amazing colleague of ours working on this project. Thank you, Priyanka. And we are recording today, both for our own internal documentation, and we may share some images or small bits of this. So if you don't want your image to be shared, no problem. Just message Priyanka if you are able, or anyone that you can that you see from Union Chapel, and we will make sure to take care of that. Okay, I think that's it from me. Like I said, you'll hear from me a little bit, but really you'll be hearing from the 8 community leaders who are going to take you through this process from start to finish. So without further ado, I'm going to turn it over to Cristina.
Hi everybody, I'm here. If you can locate me on the screen, I'm gonna have to introduce my colleagues. So if they can give me a wave up, just to say Charlotte. Hi, Charlotte. Gamze.
Hi.
David. Hi. David. I can see David. Detroy.
Hello guys.
Paul.
Afternoon, everyone.
And I think, and Maryam.
Nice to meet you all.
We are 8 in total. Thanks all of you for coming, and I would like to now pass it to my friend Detroit, who is gonna lead the first game of the day.
Okay guys, good evening, good afternoon, everyone. Welcome, welcome. Just like to say thank you all for coming today and for taking time out your busy schedule. You know, I know it's busy out there, sun's nice out. Thank you for being here today, you know. So problems, yeah, problems. We all have problems, don't we? No? No? So today we're gonna try to sort out some problems that we have, you know. If if you see it, we would like you to help, you know, not just be spectators, but like spectators with us. And if you see any problems, you can, you know, give us a shout out, please. So today we're gonna begin, we're gonna play the opposite game. I don't know if you've played this game before, but it's something new I've been learning. And you know what opposite is, right? Opposite. So if you want to turn your mic on or keep it off, it's up to you. Within this game, we would like to hear you in this mic, because we're going to do a little bit of singing opposites. Okay. So for example, today we're gonna begin the game by saying yes, 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 and you guys gonna repeat the opposite, which is no, no, no. So you guys ready? Yes, yes, yes.
Yeah.
Yes.
No,
No,
no.
no, no.
No, no, no.
No, no, no.
No, no, no.
Yes, yes,
Yes, yes.
Lovely. We're gonna do it one more time. Yes, yes, yes.
No, no,
No,
no.
no.
No, no, no.
Yes,
Yes, yes, yes.
And let's turn it up a little bit. So yes, no, yes.
No,
yes.
yes.
No,
Yes,
No,
no.
yes, no.
No, yes, no.
Yes,
Yes.
no,
No,
yes.
Yes.
No.
Very good. Yes, no, yes.
No, yes.
Yes,
Yes,
yes.
Yes, no.
No, yes, no.
Yes,
Yes,
no,
no.
yes.
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 No, yes.
Yes,
Yes,
no.
no.
No, yes, no.
Okay, let's add something new to it. How about down? So if I say down, 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 you say up, up,
Up,
up.
up, up.
Yeah. So down, down, down.
Up,
Up, up, up,
Up, up, up.
Down,
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 down.
down.
Down, up, down.
Up, down, up,
Down.
Up, down, up.
Up, down, up.
down, up, down.
Down.
I see you got the hang of it. Okay, let's turn it up a little bit. Yes, no, down.
No, yes,
Oh,
up.
yes.
Oh, yes, up.
Yes, up.
Up, no, yes.
Down, yes,
yes,
no.
No, down, up.
Yes,
Yes, up,
Up,
down.
down.
Lovely guys. Thank you. Thank you for playing this game with me. You guys, you know, I'm gonna introduce you back to the lovely Cristina, and she can bring us through the next step where we're gonna go. Thank you guys. Nice.
Thank you.
Thank you, Joy. Thank you so much.
Thank you.
I also realized that I didn't introduce one of our members before, so I'm gonna ask Sasha to wait for us because he's been a key part of this team and also helping us with taking notes. So sorry, Sasha, my fault. I would like to introduce this other game, which is gonna make us a bit confused, but let's give it a go. So I want everyone to feel comfortable and do as much as their ability allow them. I want to ask you to, with the right hand, try to draw a circle. I can see. And with your left hand, I want you to try to do a cross. So can we just manage to do these things at the same time? A bit tricky, I can see. So this is an exercise to demechanize our minds, and we do it because talking about problems is not easy, it's hard, and sometimes we need to feel a bit upside down to be able to see solutions from another perspective. So I hope this, I see someone still trying. I hope this make a step towards the introduction, because it's pretty much how we talk about difficulties. So I will now ask you to switch off your cameras, if possible, because we're gonna enter on stage mode. So we're gonna start the performance.
Sorry, I didn't hear what you said about the camera.
I'm hard of hearing, sorry.
Hi Rona, I can tell. So we're gonna start now to go into the stage, so we're gonna make our scene. So if you please could switch off your camera for the time that the play takes, you will be able to switch it on.
Sorry,
just
take slowly, I'm hard of hearing.
Sorry,
You're going to go into stage mode, and then I didn't hear the rest.
Sorry, so we're going to start the play now. So if you can switch off your camera for a few minutes, will be great.
Right.
And you can switch it on back after the play. And just checking that everyone is ready, all the actors ready. So I think with further delay, 3, 2, 1, action.
Hello, good morning. Good morning.
Good morning, sir. How are you?
Yes. Today I came into the council today because I've been currently I'm homeless and I'm seeking help. I'm trying to find somewhere. I'm seeking help. You know.
Dear oh dear. So well, I'll tell you what. How about for starters, I'll get my helpful hat on, and we'll see about giving you a bit of help.
Okay.
All right.
I like the sound of that.
Right. Here we go. Let's get that on. Right. Now, sir, what appears to be the problem?
Yeah, like I said, I'm homeless. I've been sleeping in the streets lately, you know. I've got my stuff here with me, and yeah, I'm looking. My friend said to me I should go to the council, you know.
Yeah, well, you've come to the right place, sir. Now, let me take a guess. You're looking to stay a bit permanent, a bit local. Don't fancy moving up to Wolverhampton or nothing, do you?
No.
Permanent local home, is it, sir?
Sorry?
You're looking for a permanent local home, are you, sir?
Anywhere, really.
Yeah, well, I can certainly help you. How about I could ask you a few questions, mate.
Go on, shoot.
Well, what we're going to need, sir, is to work out, you know, what your level of need is. So, have you got any medical issues, perhaps?
No, I don't think so. Not I'm aware of. No, why?
Okay, well, you know, sorry to broach a difficult subject, but you know, any sort of ongoing matters with substance misuse, maybe, or you know.
Well, I wasn't addicted before, but I'm fine now. You know, it's just I'm going through a rough time. I'm on the street. You know, I'm trying to get things back on track.
Right. Well, you could probably. How about anyone you're caring for, sir? Any responsibilities there?
Nah, it's just me.
No, so it's more possibly stuff around the substance misuse, would it be, sir?
Well, you can say so, but I don't.
Yeah. There we go, sir. You've hit the nail on the head, sir. You want a permanent home? You've hit the nail on the head, my John. John, was it?
Yeah, John.
That's right,
Smith,
sir.
John Smith.
Well, I'm going to give you a little bit of advice, John. What you want to do, you want to get yourself down to your GP, have a little chat with your GP about what's going on with you, and then get a little letter for me, bit of evidence, because I don't know if you've got a substance misuse problem, have I? Get a little something in writing, and then we can talk shop or home, so to speak.
Okay.
So do you fancy trotting on down to the GPs?
What time you guys
coming
close?
Back and have a...
It's Friday and you know? No? Okay.
Well, it won't take you too long.
All right, then I'll shoot
you get yourself down there because you've got your local connections, sir. So we need a bit more. Find out a little bit about it.
Oh, okay then. Thank you.
See you soon, John. Thank you, sir.
Yeah. Cheers. Yes. Hello.
Hello. Welcome to the medical practice. How can I help?
I was sent here by the council, yeah, to get a GP. He said to see the GP.
Oh, so you want to register with us?
He said I should see the GP.
Are you registered with us, sir?
No, I don't have a GP. No.
Okay, no problem. If you fill out the forms here, we can get that sorted for you.
Okay. Okay, then thank you. I feel this out
You're
now.
welcome.
Okay, there you go. It's all done. Thank you.
Thank you. Oh, we seem to have a problem here. You're missing the address?
Oh yes, about that. I see I'm homeless, yeah, and I don't have an address.
I see. Unfortunately, you need an address to register at the GP. But you have a lovely day now. Goodbye.
What? Oh.
Excuse me. I just heard
Yes,
that.
sir. How can I help?
That's not true, because you can see a GP without an address. That's not true. And there's a GP in Hampstead Road, I heard, that's specialized for homelessness. So it's not a fact. So you better look into that.
Well, if you hold on, I'll just double check.
Register here. So,
hello.
Hello, Dr. Teddy. We have a patient here who would like to register but doesn't have an address.
Yes, well, you should know by now that's not the policy of this practice, I'm afraid. He'll have to go somewhere else.
Thank you. I'm sorry to inform you, sir, but unfortunately, although, as this gentleman said, it may be law, but within our GP policy, we can't accept you. But you are more than welcome to go with the gentleman. Have a lovely day.
Listen, mate, just come down the road, all right? Down Hampstead Road, there's a place that sees clients who don't have houses, all right?
Yeah, all right then.
Hampstead Road, check it out. That's really off, man. God.
Okay, thank you guys. Have a nice day. Thank you. Thank you very much. Bye.
Is there a Mr. David here? A Mr. David?
Yeah, that's me. That's me.
Oh,
that's
hello,
me.
sir. Dr. Diddy's ready to see you now in room
All right,
number
brilliant.
3.
Hi, doctor.
Oh, hello, sir.
Yeah, I have a problem. About 3 weeks ago, you gave me some antidepressants and they're not working. Could you put up the dose or give me something else, please? And also, I've got side effects. I keep going to the toilet and I'm not sleeping properly.
Yes,
Actually, I do need to change my tablets.
Well, I'm afraid, sir, as I advised you before, you are going to need to give it more time. It can take quite a while for the side effects to subside.
But I have given you time. 3 weeks.
Excuse me, sir? Are you raising
3 weeks?
Voice? 3 weeks, yes. I'm afraid it can take 6 to 8 weeks for these side effects to subside. And, you know, as I told you before, you can ring the receptionist in the meantime. They can give you some simple over the phone advice, but I'm afraid you're just going to have to sit it out a little longer, sir.
Oh, come on, that's terrible. I keep going to the toilet and I'm not able to sleep because of nightmares, because of the tablets. There must be something you can do.
Well, I gave you the sheet on sleep advice before. You can also find more on our surgery website. I'm afraid, so there's nothing else I can do for you today. Give it a little bit longer and you can call the surgery if you need any more ad hoc advice.
All right. See you in a couple of weeks.
Goodbye.
Hi.
Oh, hello. How can I help?
Hi, sorry, I have an appointment like 20 minutes ago.
Could you give me your name?
My name is Maria.
Your surname?
Garcia.
Garcia?
Garcia.
Garcia?
Garcia.
Oh, Garcia. Oh, you should have said so. Okay. Hold on 1 moment, please.
Hello?
Hello, Dr. Deddy. Your 2:30 appointment is here. Shall I send her in?
Yes, send her in, please. Thank you.
Okay. Okay, Miss Garcia, if you wouldn't mind going to room number 3. Have a nice day.
Okay, thank you. Hi.
Oh, hello, Miss Garcia. What seems to be the problem today?
I just, been here before, but I wonder if I can speak with psychologists because I'm having a lot of problems with, like concentrating and I'm not sleeping very well. And also start to see, things moving, like letters from documents. I'm a bit like, I'm a bit nervous about this because I didn't have this before. We talk about the chronic pain I have for years, but you know, this
Okay, we need to talk about one issue at a time, I'm afraid. I'm going to need you to slow down a little bit. If there's multiple issues, you're going to have to make extra appointments, I'm afraid.
I did the other appointment like 3 weeks ago, and we just decided to talk about psychology today. So I wonder if I can speak with somebody.
Well, I remember, Miss Garcia, that I think you came to me before, and I'm afraid that there's a very, very long waiting list to see a psychologist for assessment. And we need to have tried other strategies first, for example, the antidepressants that I advised. You seem to be suffering from low mood, but tell me, you know, do you work?
I'm working, yes, I'm working pretty much 6 days a week.
Oh, well, that's good. That's very positive that you are managing that, yeah.
Yeah, but you know, it's been complicated with all the symptoms I'm having, and I'm just, you know, I don't know how.
Well, you know, everyone's suffering from workplace stress at the moment. It's a very difficult time, you know. As I said, I really suggest that you do try some antidepressants, but first, you know, how much are you drinking?
I actually drink a few times a week because, you know, we are a music venue. So, I mean, I work in the cultural sector. So my boss constantly invites us for drinks after the play and stuff, but I don't think I have any problem with that. It's just, you know, like I've been kind of forced to stay over because, you know, if we don't stay, we stop, you know, it's a kind of gathering. So
you are going to need to have a look at our drinking advice, please, especially if I'm going to prescribe you these antidepressants. So I've suggested citalopram, a minimum dose to start with.
No, I don't want to take, sorry, I don't want to take citalopram because I just took it before. I think, you know, we talked about this last week, that I took all of these things before for chronic pain and I have problems.
I'm afraid it's our first primary care for low mood, which it seems you're suffering from. And until you give these a chance, I'm going to have to, we also have the peer support meetings I suggested. Can I give you one of those?
Oh yeah, please.
Yeah, okay, well, I suggest you go to one of those. Many of our patients find those extremely helpful, especially while they're getting settled on antidepressants.
Sorry, is any possibility that I can go to this after hours, because these times are all in the working hours and I don't think I can do this with work.
Well, I'm afraid that's just the way it is. I can sign you off for a few days if you think you'd find that helpful.
Oh, no, please. I don't want my work to know about this.
Okay, well, I mean, I'm offering you what I can, Miss Gatia, and I'm afraid if you don't want to take time off and you can't go to the support groups, I think it's even more important that you give these a try. I'm going to take this, please. I'm starting you on a minimum dose. If you have any side effects, you can call the surgery and ask questions. They're not going to interact with anything else that you are taking. And do look at the alcohol advice sheet as well. I'm afraid we're running out of time, actually. So I've got another patient coming very soon. If you need to make another appointment, you can do that. Miss Garcia, sorry. Hello?
Hi, Dr. Teddy, your 245 is here. Should I send them in?
Yes, please. Yes, please. Goodbye, Miss Gatia.
I just never get understood what I want to say, and I'm just really stressed. I wish this place will be more able to help me. Now I'm gonna be late. They never listen.
Okay, everybody, is everybody ready for the meeting? Are we all here?
I'm late. I'm sorry, I'm coming.
Second time.
Hi.
Time, yeah?
Yeah.
Yes.
You all right? Looking a bit tired.
Yeah.
Looking a bit tired there, not your normal pretty self.
Oh, totally fine, Susie.
When you're ready, we'll go.
Yeah, thank you.
Okay, so we're back here, Islington People's Theatre. Yep.
Yeah.
You're ready to go? So, last year we were the best theatre in Islington. We need to get that going again this year round. Yeah, so I need some ideas about how to bring that forward. Any ideas?
Yeah, I emailed you everything. Did you check my new ideas?
When did you email me?
Last month.
Last month, at least you know how busy I am. New guy, Seb, any ideas? We want to bring a new crowd in, any ideas?
I got one word for you, Jack. TikTok.
What's that?
TikTok.
TikTok, okay, tell me more.
We're going to get out there, we're going to get our phones out, we're going to make a couple of movies, stick it online, the kids are going to float in.
Brilliant, love it. Love it.
Oh, yeah, that's great.
I
told you before about that idea. And you
What's
said,
that, Lisa?
I told you before about TikTok. I explained everything exactly much better than Speedy Zip. But
TikTok, when did you give me this idea?
Last month.
Did you send me a proposal?
Of course, and I even made a presentation on your.
Right, okay, right. We've only got a short limited amount of time. There's no need to go on about it. Like if I have seen, Maria, can you make sure I get an update on that email that Lisa sent? But for now, let's Seb, can you elaborate on the TikTok idea?
Jack, it's so simple. Me and you, we'll get out there, get our cameras out. Got Abigail come, she's really good at it, and we'll film, we'll record, we'll talk, we'll laugh, we'll joke. Everyone will come running.
Love it.
Well, when I told you didn't like it.
Lisa, one, come on. Maybe Seb, if you work with Lisa on this, you can give her an update on your ideas. And then
I'll tell her the ins and outs.
Perfect. Any more ideas? David?
That's what it is. That's why you didn't hear me. I was off. Listen, talking about TikTok, what about funding? Funding. I've talked to you about it before. You can't introduce any more policies without funding. So that should be first on the agenda, okay?
Yeah, that's an important point. So if you work together with Lisa on that, so maybe I'll just put Seb on the TikTok project and you work together with Lisa on the funding project. Sound good? Great. Let's get on to the next issue. Anyone else got any ideas?
Yeah, about the funding, we made another meeting about it, that we have to attract more community.
Lisa, do we need another meeting if you're going to work with David?
I offered to help you in that too. I offered to help you. The thing is, we're doing just meetings.
Lisa, let's have solutions, not problems.
The solution is the funding deadline is next week, and we're just talking about it. But
we work with David on it. Maria, you okay then?
Yes.
Are you up to date with everything?
Yeah, yes. I just forwarded.
All right, so Lisa and David are going to work together on the funding opportunity. Seb is going to go through the TikTok proposal with Lisa. I know Lisa's got some loose ideas on it already, but Seb's going to fill her in. Are we all up to date with that? Yeah? Yeah.
I mean, if you listen to me before, we won't just waste the 1 month. I already told everything.
Lisa, come on, no need to be hysterical. We're all trying to work together. We're trying to be a team, and you're just bringing problems at me. I mean, is it?
I'm working a lot more than everyone, and I made a proposal about everything.
Okay, right. All right, Lisa, perhaps you and I should have some time. Guys, I think we're done with the meeting. Lisa and I are just gonna have a little catch up. Seb, perfect, love, good initiative, love it. Maria, next time come a little earlier. And wear that shirt that you normally wear.
Thank you.
Okay, thank you.
Bye, Jack.
Bye. Lisa, what's going on? You're normally so positive. Is it that time of the month or something?
No, I mean,
What's I don't understand all this interrupting. You know I value your opinions.
You don't just care what we told. I already sent you. I made a presentation. I sent 3 different mails about
Lisa. Look, Seb is a new guy. We're all about equality here. We need to embrace new people. We need to work as a team. You know, I value your ideas, but you know.
I already told everything what we told.
Lisa, where's that smile I love, huh? Where's that smile? Where's that smile I love?
I'm not smiling now. We're talking about work, right? Why should I smile to you?
You know, everyone, that's why you were hired, because of that bubbly nature. Do you know how many women applied?
What do you mean?
Anyway, I gotta go. Yeah, 5 minutes left, but you're happy? You're gonna work with Seb? Perfect.
Yes. John here. Hello?
Hello, John. Welcome back. Welcome back, mate. How are you?
I don't know. Mate, you sent me all over the place. I went to the doctors, the GP, yeah? And I can't get a GP because I ain't got a place to live that.
Right. So you didn't, they didn't sign you up?
I can't because I don't have an address. And some guy was telling me about Amsterdam something. I don't remember, but I didn't even write down. It was either go there or come back here. It's like Friday, and I'm on like.
Right. And
what GP do I go?
Something permanent you was looking for.
I need an address to go to the GP. I don't have an address. I live on the street. It's Friday.
Right.
They said I can't sign up at the GP. Do you have a GP I can go? I don't know.
What I'd suggest is you make your way down, have a chat with the social worker. I'm gonna write it down for you, and then we'll see you there, sir. But I'm gonna. It's 5 o'clock. I've got a clock off. Like I said, if something permanent, we need a bit more from you, sir. If you want to stay in the area and you've got this caring connection, sir. So I'll write it down for you, but I think that's about it at this point in time. But bring the evidence, and you know I'll be more than happy to help.
I got all this evidence. I got all of my papers. I got notes, my old address, all of that. But
sorry, sir. I would need a bit more.
And then I keep going around in circles. Social worker. I do that.
I'll write it down for you, sir. I'll give you the number. We've got a phone. You give them a tinkle pop.
You know what? I'm gone, man. I don't know. I had them by.
That'll be your choice, sir. Should you want the address or not?
Bring your videos back. Come on back, everybody.
Well done, everybody. We could just give one last round of applause to everybody that was in the play. That's the end there.
Well done, guys.
Okay.
Brilliant. Go ahead.
So now that we've just seen the play, I just wanted to pull it through and see whether anyone could identify any problems that the characters faced. This is going out to everyone in the audience there. Were there any problems that you recognised?
You can type them in the chat as well if you want to.
I see Bernardo has a hand up. I'm going to look for hands.
Wait.
Bernardo has a hand up.
Something I saw was how the time pressure first character we saw dealt with, having to get things done before the business day closed.
Great. Anyone else got any in?
There's loads coming up in the chat as well.
Rona has her hand up.
Great. Rona, would you like to go?
Rona.
Yeah, Jack was quite sexist towards the project manager. He wanted to encourage the new bloke, but in doing so, he basically undermined the project manager. At the GP, I thought the character was quite insensitive, lacking empathy. Obviously quite stressed herself, but the lack of eye contact and the inability to kind of treat the patient as anything more than just she seemed very jaded. The character seemed really jaded, and gave the patient incorrect information. It didn't sort of treat the patient very, very, very well, very professionally. Quite a few other things. The first character who was the one who was the homeless gentleman. He wasn't offered emergency accommodation, and he should have been offered. It's just that Harry had in his head, "Oh, it's permanent you're looking for. We can't do permanent straight away." But he didn't say, "Well, you're on the streets. Let's get you into a shelter." There was none of that. There was quite a few issues that came up, but those are the ones that I can immediately remember.
So you identified quite a few issues. Great.
Jo has her hand up. Jo had her hand up.
Okay, would you like to go?
I wrote it in the chat, but it was just about not being listened to, and kind of having to jump through hoops, like with the GP saying, well, you have to do this before we can offer you any other kind of help, which, I've experienced. So it can be frustrating, yeah, if you don't want to, you want an alternative option and they won't offer you one before you do something that they expect you to do.
There's loads of good ones actually coming through in the chat. Ian says that they have their hand up and someone's taking it down. So I don't know if Ian has anything to say.
Lisa's got her hand up as well.
So would you like to go, Ian?
Yeah. Well, I did say the part, I must say, unfortunately, the medical from the homeless persons is fictitious. They never asked for that. They didn't go into enough. But I'd say the real problem is most homeless people, when they go into homeless persons units, the HRA, Homeless Reduction Act, is supposed to stop this, but it hasn't, is they avoid. So at the end, going to a social worker, because normally the person will be to see if they are if they're really homeless. They would send a worker out. There's no social worker. And the other thing is, it does happen that when he said about the drugs in the first bit, they make assumptions, a lot of workers. And that should stop.
Thank you for that. Paul, go ahead.
Yeah, sorry to break what they say, the fourth wall. Ian, because we had the interaction about it on the chat, and I think I wanted to share as well in terms of facts and the fiction. One of the things when myself, David and Detroy were setting that part of the scene, I think we wanted to get across that all three of us having experienced those situations, something of the confusion that people may face and some of the, dissonance. So my character was quite dissonant, and that's what potentially someone may be seeing at a time of great stress. And I think that was something we wanted to get across.
I write about this stuff, Ian. Shut up, Ian.
Right, yeah. So we're trying to
write about this
creatively
stuff,
get the confusion.
right? And actually, I'm involved quite strongly with other organisations, so I'm quite aware of what happens in these units. So the thing about the health thing, I was really saying, there is a lot of avoidance from homeless persons units. All right, the health thing was fiction. Okay.
Does anyone have any? Did anyone recognise any challenges faced? I mean, someone brought up sexism.
Sorry, Lisa's had her hand up for quite a while.
Oh, sorry.
Lisa Ogan's had her hand up for a while. Sorry.
Lisa, would you like to go ahead?
Yeah. So the first housing officer in the for John's.
Sorry, Lisa, your sound is really poor. I can't hear you at all.
Okay. So, oh yeah, can you hear me now?
Slightly better.
Yeah. So sorry about that. Yeah, the housing officer for John's character at the beginning was quite unprofessional. I mean, the whole putting on the hat and the presumptions and lack of knowledge. He just wasn't competent. He wasn't competent at all. He had not much knowledge, and being very, very presumptive, as Ian has pointed out as well. So that was the very first obstacle that our character John faced, even before he even got to the GP.
Okay, thank you. So I just in case I've missed some of the hands that have gone up, is there anyone that has had their hands up for a while that would like to add to that?
I see Pixie has a hand, and LaToyah, could you just repeat in a sentence or two what Lisa said? I see some people typing in the chat, but just so we can all hear. And then Pixie.
Yeah, so from what I heard from Lisa was that her main point was that the character was quite unprofessional. Is that correct, Lisa? So I guess I wonder how many people have lived experience of unprofessional people in that position. So Kim, I see your
Pixie. Sorry, I saw Pixie.
Okay, Pixie.
Yeah, that was what I was going to talk about, which is basically that I went to Lambeth housing place, and they told me that basically he made a joke and said the only way I would get a place on the land.
Oh, I just missed that last bit. The only place. Sorry, Pixie, your sound is a bit. Your sound is a bit jagged. If you'd like to write that in the chat, then we can read it out for you. Sorry, Pixie, I was unable to pick that up.
And being a male, I think that is. Yeah.
Are you able to type it in the chat at all, Pixie? Because we're struggling to hear you. Sorry.
Okay.
I'm actually.
I'll type it in now.
Brilliant.
Okay,
thanks, LaToyah. Just before we move on to the next bit, I was just going to read a couple of, there's some really good stuff in the chat. If people are able to see it, I recommend scrolling through, but there's a lot of stuff about gatekeeping, whether it's gatekeeping while you're making a homeless application, gatekeeping in the GPs. People picked up on our the general atmosphere we were trying to show of people not being listened to and really trying to self-advocate and not being listened to. Unprofessionalism comes up a lot, sexism in the arts organisation, the system being really hard for people to navigate, particularly people who are vulnerable or marginalised in any way. And yes, GP assumptions, you're working, therefore everything's fine and you must be coping. Yeah, the disruptive typing, also very well noticed. And yeah, sexist comments from the boss being passed from pillar to post as well. So people just getting passed around, we were trying to bring up as a theme. And the next question that we wanted to ask people was, can you think of a time that these problems have really happened to you or people around you? If people could just sort of maybe raise their hands if they've experienced these problems or they've seen them happening to those around them.
And I'll keep an eye out in the chat.
That would be perfect, thanks, LaToyah.
So we have Laura in the chat saying, doctors saying they have to make an appointment for each issue, not seeing or asking about the whole picture and potential connections of symptoms.
Absolutely. There's a lot of people who raised their hands as well when I asked whether people had really seen these problems happening around them. And I think that proves that the things that we showed in our play are happening. We used some atmospheric license for sure, but they were about the experience of having had those things happen to us. So yeah, does anyone have anything that they would like to say about somewhere they've seen these problems happening?
So we have Pitsy that says, I went to Lambeth homeless unit and was told the only way I would get rehoused was to get pregnant, which obviously is a totally wrong thing to say because he is male, and he found that really dismissive. Laura put the GP, the mental health team.
If anyone's unable to use the chat and wants to say anything, I'm scrolling through the pages, so I should be able to see if anyone's got their hand up.
And Cristina also says the social services. So these may also be issues that have happened to someone that you know. It may not just be about experiences, lived experiences that you've had. We have Adar that says, in the reality before COVID, it was tedious, long and difficult to even get to the point of night shelter from point of contact when homeless.
Yeah, okay, well, I'm just having a look through and I can't see anyone else with anything to contribute as an example, but that's totally fine. And I just want everyone to kind of think about how it makes you feel that these things are still happening around us, you know, and we'll just have a community. Sorry.
We just have a few more coming through from the chat, so I'll read out Catherine. She said, I advised a client who approached the London Council when she was heavily pregnant to make a homeless application. She was sent away to get proof of pregnancy with no accommodation offered or application taken. Then we have Rona, who wrote, I was bereaved in 2015. I received a call offering me counselling 3 weeks ago. Wow. We have Martine, who says, constantly and issue for our clients being offered antidepressants when they need psychological support.
Yeah, absolutely. Oh, there's another one here. When having a test to see if someone was ill enough for benefits, small details like being able to wash or walk from the bus are used as evidence against you that you're well enough for work, which is very different from being able to work on a daily basis. Brilliant, thank you for that as well. And thanks for people's contributions. There will be an opportunity to say a little more as we go through, but I'm going to hand over to Paul and Maryam to talk about ways we can activate ourselves as an audience.
What we're going to do now,
hi guys,
we've had a good chat about some of the issues that have come up from seeing this performance and some of our thoughts and feelings about it. So we're now going to go with that in mind into breakout rooms as small groups or duos and think about what you would do if you were in a character you were affected by's shoes. So if you were David and you were in the doctors and you saw what had happened to John, what would you have said next? Because nothing kind of happened, or what have you. So hopefully that's clear enough. And then when you come back from the breakout room, we'll go on to the next stage. But we are moving towards us having the opportunity to meld and move forward the performance, because we all are together spectators.
So just to jump in, one little note is that these breakout rooms are very quick. So you'll really just have about 2 minutes, 1 minute each, because we're coming back to interact with each other. And that when you're in the rooms, you can think about what also resources do you wish you could have had in one of those moments, because we're starting to think about what policies we want to see. So really, really brief breakout rooms. Don't need to spend so much time, introducing yourself. Just what is one thing you would like to do or one resource you wish you could have had? And Priyanka, are we ready for 2 to 3 people in each for 2 minutes?
Yeah, we're ready to go.
Okay, so if you can.
Sorry, just to add, could you try and think of yourself in the oppression part rather than the people that are in authority when you go into thinking of solutions? or alternative ways that you want to progress.
Did they think in terms of the oppressor, being the oppressed or the oppressor? Confused.
Yeah, to being the oppressed rather than the oppressor. So
Right,
we can
you.
see the alternative, yes.
Great, thank you. So quick 2-minute breakout rooms to think with another person. What might you try, or what resources would you wish you could have? Priyanka, we're gonna go ahead.
I'll send it now.
You should see. Great. If anyone's in here who wants to discuss their ideas.
I have a feeling this is room 1. No, it's
Was
not.
that? Is this room 1? Oh, someone is alone.
No.
Someone is alone. Let's just move them to somewhere. Okay. All right. Anyone here want to share any ideas? Councillor Lukes or anyone else? What they might try? Just thinking. I
was wondering about the arts context because it's the one I don't work in. My chair and arts charity was just that I was surprised. If one is in a union, it makes a big difference to that sort of behaviour. But
so you were sorry, I missed a little bit of that. What were you surprised?
I was wondering whether people in the cultural organisation, the theatre company, were in a union or not, because my experience is that information makes a big difference.
Right. Is there any or how they could get access to that if that is not the case? Yeah. Great point. Great point. That's a great idea. Anybody else here, or is everyone who's here just listening? Oh, there's hello. We're just taking very quick breakout rooms, so I think Priyanka's going to close them in.
Yeah, I'm going to press close now, if that's all right.
Sure.
Sorry, my internet cut out, so I didn't get assigned to one. But
that's
I'm
okay.
back.
They're very short. They're very short. We have a lot to do. I'm glad you're here. It's good to see you.
Hi, guys.
Did you get to talk about anything? Was that enough time or very quick?
I think we still have some. We still have another 2 in the wait in the breakout rooms.
Yeah, we're letting people come back. Yeah. They're finishing up their conversations. Here we go. Hey, amazing. So Paul, are you here? Take it away.
Are we all back? Is everyone back? Yeah, great. So we all would have had an opportunity, hopefully, to share some part of the performance you've just seen and to reflect on parts that have moved you more. What I'd really like to do is invite anyone to share some of the things they spoke about, some of the characters that they might have picked up on, some of the resource issues that they may have brought up. Would anyone like to do so?
Don't be shy, guys.
Ken?
We promise we
I
don't bite.
I see Ken's hand up.
Yeah, so I mean, we talked about how difficult it is, particularly if you're street homeless, if you're trying to manage mental health issues, to feel that you can actually work within a system which is all about rules, which is all about restrictions, which is all about I think thresholds and gatekeeping. It's really what those two people, the person at the homeless office and the person at the doctors, will have been hearing is people saying no in very different ways to things that they needed. And it's a very transactional relationship, and we felt that one of the things that's very hard to do is to actually keep it cool, not get angry, but also that it's really important that if you can understand the system and work out how to navigate that system, to do so and to take some power back. But if you can't do that, I think it's just so important that you try and get the people who are sitting at the other side of the desk to see the human being and not just a problem, and hopefully to work with you in a more relational way. But
they're very, very valid points. I mean, that's amazing. However, if I could entice you, do you have a way that you can show us, so an alternative, if you'd like to play a role, and then see how you navigate through that differently? Would you like to try?
And we'll set up a scene. We'll set up a bit of the scene where you'd come in.
I'm regretting putting my hand up now, but I'll give it a
go. Thank you so much.
Okay.
Woohoo!
Where would you have come in? What part, sort of, if we set up a bit of the performance, what part would you come in? Would you be one of the actors, or would you be Ken in somewhere, or?
I'm not sure I understand the question, but
which scene stuck out the most to you?
I guess the homeless gentleman, John. I think John, who met with unhelpful Harry.
Okay.
Yeah, I'd be John. Yeah.
Brilliant. So what we'll do, we're gonna have everyone outside the scene could switch off their cameras and microphone, and what we'll do, we'll get you to jump in on that scene.
Okay.
Are you going to be John, or are you going to be somebody else in the office at the time?
Either way, I can be someone else.
John, you should be John.
John.
Jumping in. You should be John.
Okay. Right. Okay.
Right. Okay. So, we'll start.
So are we all muted up first?
Would you like to start from what part of that scene would you like to start from?
Okay, so take it from the top. Yeah, so
okay.
I need a place to stay. I'm street homeless.
Okay, well, I'll count you in. 3, 2, 1, action.
Well, sir. Welcome, sir. How may I help you?
Well, I was told to come here. I'm street homeless at the moment. I've got nowhere to stay, sleeping on the streets. Yeah, I was told that you might be able to help me.
Well, I certainly possibly could help you, but I ought to get my hat on first. And then I can be as helpful as possibly can be. Now, sir, we could help you if you're street homeless, but how do I know that? I mean, resources are scarce, sir.
Well, I mean, what sort of evidence do you need? I'm sleeping on the streets. I have all of my stuff here. At the moment, all I have with me, all I have is what I have here, and my words. I'm street homeless. What do you need to know?
Of course, so well, if that's what you've got and that's the evidence basis, well, we could offer you a bit of shelter for tonight, see you through, keep you warm.
Okay, and what about the long term? What happens tomorrow? It's a Friday at the moment. What happens on Saturday?
Well, of course, I mean, we'll get through the next few nights. I mean, we've got, let me just, sorry, I'll have a little look. Yeah, we've got a place in Croydon.
Sorry, just jumping in, just unhelpful Harry, this is your boss. Just remember that the rules apply the same as everyone. So, you know, he needs to go to the GPs. Don't forget.
Yeah, well, what we need to do, sir, is, you know, after you're going to go to hospital for the weekend, go down Croydon, you're going to come back. Are you looking for something a bit more permanent?
Well, yes, I need somewhere to live. I'd like a bit of security and stability.
Absolutely. So, well, you know, you're going to have to get yourself some evidence together, get yourself down to your local GP, and you know, bring it back, and we'll try and help you some more permanent accommodation.
And what is it that you need from my GP? Obviously, it is Friday, and I'm not registered.
Evidence of need, sir. I mean, if you want a shelter, we can get you to the place down in Croydon. Yeah, there's houses all around the country as well. We'll get you straight there. But if you're looking for something a bit more permanent, I can judge a character from a mile off. You're probably looking for something local, something permanent, near your old mates, near your family, what have you. Well, we're going to need a bit more evidence, sir. So we're going to get you shelter for the weekend, get yourself down to the GP on a Monday morning and build it up.
Okay, so I'm not registered with a GP. GPs are extremely busy. The GP's not going to know me any better than you do. So it feels like you're just almost sending me off and to come back with something that actually isn't going to provide any more evidence than we have at the moment. So I'm just wondering whether you can just really tell me what my options are and work out how you can help me, you know, directly without me having to go through this rigmarole.
Well, sir, I believe I certainly have, because help you, you're homeless, we offer you a shelter in Croydon, and then you're going to go and get more evidence for, as I estimations, that to get you settled in a bit more. I mean, you should have a GP, shouldn't you?
Yeah, unfortunately, I don't. I think the problem is because I'm street homeless, I can't register with a GP without an address, and you're telling me I can't get an address without a GP. I actually need somebody just to kind of step in and help me out here.
Well, sir, I mean, you know, I've got me job. I'm not the GP, so I'll just stop you there. I'm not the GP. I'm here to help you get shelter. What I've done, I would say, get yourself down to the GPs, get yourself down to the health office, and get yourself sorted out.
Okay.
Thank you, sir. I mean, there's a lot of people outside, so I think we're going to have to, if I may be so bold, pull the shutter down. But hopefully see you back. And if you do want a place in Croydon, we'll sort you out.
Okay. All right. Well, thanks for all your help.
Have a good afternoon, sir.
Thank you so much. Woo, woo. That was amazing. So I'll be curious to know, is there anyone in our audience who can spot any difference in that interaction we just saw with our latest edition, Ken, and with our unhelpful Harry? Can we get a show of hands? Oh, okay, Bernardo, would you like to add something?
Yeah, Ken's reiteration of John showed someone who was advocating for themselves much more thoroughly,
Right.
which was both touching and also heartbreaking at the same time, knowing that John, the initial John, wasn't equipped or informed that he had that option.
Right. Brilliant. Thank you so much. And I saw Kay, you had your hand up as well. Would you like to add something? Oh, sorry, we can't hear you. Your microphone is on mute.
I'm a tech idiot. I'm so sorry.
No, don't worry.
I was just summing up Ken. He did such a good job. I think it's good that he was more assertive, but also the housing officer by law has to be very specific about the evidence that is needed. He has to write it down and give it to him. He has to write a note for himself. And they usually give out sheets that have information about people that can help homeless people, like the person in this scene, and other organizations that can help.
Right.
So it's not a question of, oh yeah, you need to get a bit of evidence, mate. They have to actually follow a process and ask certain questions and give actually on paper the exact evidence that is needed. They can't just say, oh, bring us a bit of evidence, mate, and we'll sort it. That's not how they talk.
So would you guys...
Ken was great because he was more assertive, but he wasn't being given the information. Like, he was asking for specific information, weren't you, Ken? Like, what do I need? And the housing officer wasn't giving it. And I think maybe it's because the actor didn't know what the evidence was. So maybe
that's a valid point. Are the people within the social structures that we need assistance from, or that we go to when we need assistance, are those people even aware of the protocols that they have to follow and what real help is out there to give to the people who are asking? So that's a very good point and something to question.
Sorry, Ken has your hand up. Go ahead, Ken.
And I think, yeah, all of these things that are being said are true. Fundamentally, there are problems that are system-wide that also contribute to this. One, there isn't enough housing in Islington to meet the needs, and that's an issue. And then two, people who are on the front line, who are customer or resident facing, aren't empowered to have relationships that, you know, kind of are anyway human or anyway responsive. I think that I think sometimes your frontline staff are also trapped within a system where they have very little agency, very little ability to respond in any way that is meaningful, and they end up almost giving excuses and spouting rules which do not make any difference to the problem, but it's almost just telling people in different ways, no, I can't help you.
Brilliant example. Yeah, brilliant point. It is a brilliant point. Do we have anyone else who would like to? Yeah, go ahead.
Sorry, Councillor Richards has had his hand up. Go ahead, Councillor Richards. Sorry, Councillor Watts. Sorry.
So, I get kind of lots and lots and lots of casework from people who are in terrible housing need each year as leader of the council. So, you know, spend quite a lot of the time I spend talking to individual residents in Islington, talking to people about their housing need, which is obviously massive. And to give some sense of context to it, there are about, Dermot, correct me if I'm wrong, 10,000 odd people in real housing need, assessed housing need in the borough.
Correct. Correct. Yeah.
And about what is usually 800 or 900 properties come up each year, but it's been a lot less in COVID. I mean, a lot less in COVID because people haven't been willing to move in the pandemic. So, you know, so you're trying to move about 10,000 families into a few hundred homes that come up each year, to give you a bit of a sense of kind of what the squeeze on housing resource is. So kind of recognizing the picture, not precisely, I'd be incredibly disappointed if the conversation went exactly like how Paul played it, but yeah, kind of recognizing the broad picture of what's being presented, because I think Kay was right that actually the nature of the housing needs sector is incredibly tightly regulated by law, and you get sued really quickly if you don't give very, very precise evidence, and rightly so, and you lose, and rightly so as well. And I think so I'd be quite surprised if there are people who didn't understand the law in which they were operating in. What I'm completely willing to believe, because I see it myself as a councillor quite regularly, is that we go into some of those conversations in quite a regulatory way, effectively to get the law right, rather than to provide kind of the assistance people need to solve a problem. And I think there is a culture change, which I think we recognise and have been trying to go through as a council, but it's quite, but people won't necessarily have seen it yet, because the number of people even coming through our door in a pandemic has really dropped as well, which is about trying to understand what you can do to actually help people in the context of 10,000 people in desperate housing need and a few hundred people getting rehoused each year. What else can we do? And what are the issues that stop people needing rehousing in the first place? And that wider kind of sense of early intervention, prevention and support is actually much more the direction we're trying to head in as a council. But that does require less gatekeeping at that stage and more of trying to get to a true picture of what someone's issue is, and kind of then trying to understand what other issues are. Because the reality is probably new housing is the last thing we're going to be able to provide, given this, the inescapable squeeze on new housing numbers in the borough.
Thank you for your input.
Yeah, can I just jump in there for a second, Maryam,
Sure.
and Paul, because I think we're about to move on to one more situation, but I just want to recap a few things for us. And actually, Priyanka's taking some notes about the kind of structural barriers and some of the ideas that have been mentioned that we're going to use just in about 10 minutes to write our own policy proposals about these problems. So some of the things that Councillor Watts brought up, that other people brought up, that just to recap for us, I think are really important. One is, the fact that if there are so few homes available, right, then that information, first of all, maybe is not, people don't know the situation, right? So that the information about what the situation is, and then the regulatory way or the kind of clinical way that people are being met, as Ken brought up and Councillor Watts brought up in the council, right? And not being offered different kinds of support, as I think Kay brought up, the other resources, are they being given other resources there to help? And people are talking about the kind of inhumane engagement, which may also be, as other people brought up, because those folks at the council are overloaded. So what is the burden on the staff of dealing with so many people? Absolutely. So those are some of the structural barriers we're noticing here, and some of the opportunities we see for change. Just seeing, the workers themselves are stressed, and anything else on that we should add in before we move on to the next one?
And yes, definitely, just to add, having a certain knowledge of limitation within the local council, maybe that's something now for the rest of us to think about, how we're going to make changes at a higher level than the council in order to restructure or find help to, facilitate more help for the people. Yeah,
absolutely. So I think, should we give another round of applause to Ken for sparking that conversation?
Thank you so much, Ken.
Yeah, let's pass it to David to lead us in one more intervention. And I think David, I'm just going to start this off by saying, I think there's been a lot of interest in that kind of sexist staff person scene too. So
right, brilliant. Hi guys, that was really interesting, and thanks for everyone for engaging. So we had the protagonists. We had the homeless guy John, we had Christine, and we had the girl, I think it was Lisa. So would anybody like to have
a go at playing Lisa, please?
You would like to have a go. At what part in the scene would you like to portray?
I'd like to have a go at speaking just after Seb comes in with his TikTok idea, just from that point.
Excellent. Right, so the format's going to be, it's going to be exactly as the play was depicted. So it's for our guest who's going to play Lisa to actually maybe reimagine the situation in a different way, in a way that she would suggest it would be better, so to speak. So anyway, let's go.
And Rona, as Lisa, I just want to add in one more note, which is that if there are any other characters that you think you might need to call on, somebody might play them if there are. You don't have to, but I just wanted to put that to you if you needed to call on anyone else who's not in the scene. Okay? Okay. So David, set us up. We need the actors, right?
Yes, so can we have the actors? So we want everybody in that scene. Can we do that? And can everybody else turn off their screens, please? I'm in the scene as well, so I better get my position. Is everybody there? Has everybody turned off the screen? Because I've got a phone here, so I can't see everyone. So please excuse me. So we're all set?
We're getting there. I think we're all there, right?
Excellent.
Maybe.
Right.
One second. Okay, I'll give you a 3, 2, 1 action since you're in the scene, David. Okay.
Yeah, thank you.
So, so just after Seb says TikTok, so we don't need to take it from the beginning. Is that right? Okay.
Right.
And let's see what happens. 3, 2, 1, action.
Brilliant idea. Brilliant. Love it.
Jack, sorry. Can I refresh your memory? About a month ago, I did a presentation to both yourself and Miss Rubin of using TikTok as a marketing tool. You both absolutely loved it. About a month ago, where are we now? We're at the beginning of end of March, beginning of April. It would have been probably the end of February.
Okay, if you send me that email again, because you know how I miss my emails.
No, Jack, it wasn't an email. It was a presentation to yourself and Miss Rubin.
There you go. How am I supposed to remember all of these things? You have to send me an email. You know what I'm like. Why don't you speak?
Jack, we followed it up with an email. We followed it up with an email, and you responded to that email. You responded to that email, and said you were going to keep the project going. I'm happy to work with Seb. I know he's a new guy. He needs encouragement. We are a team after all. But credit where credit's due, you approved the presentation along with Miss Rubin a month ago. Miss Rubin, would you? Can you actually hear what we're saying? You know, I'm sure you remember about a month ago you approved the presentation.
Okay, so we're just going to move on from the TikTok idea. So Seb and Lisa are going to talk about the TikTok idea. Lisa had some loose ideas about a month ago. Seb, if you update her with the new ideas you have now, that'll be great.
No problem.
If you just put that in the notes, remember to send that email. You know, Lisa.
Well, we're going to resend the email, and
Lisa, we've got about 10 minutes left in the meeting.
I'm going to have a chat with Miss Rubin, and I'm going to have a chat with the Equalities Commission if this goes any further, because this was not Seb's idea. This was originally mine.
Okay.
I remember you saying, actually, Rona. Now I come to think of it, I think you did tell me that.
Perfect.
She's right.
Right.
She's right at that.
Yeah. Great. So you go ahead and do that.
We will.
But in the meantime, if you just work with Seb, and we can progress the idea.
I'm happy to mentor the new guy. Happy.
Okay. Brilliant. Can we give her a hand, please? Thank you. Right. Can everybody turn the thing on again on the screen? Thanks. Well, that was really good, and it was really different. Can we see, or can someone say what happened there? What was different than the original scene?
See.
Lisa.
Yeah, Lisa, is that Lisa has got your hand up? I can't see everybody, so excuse me, because maybe someone else can help me as well. What was you going to say, Lisa?
Rona was very assertive and was able to explain.
Oh, I can't hear this. Is it my receptor?
No, it's not you, it's mine. Sorry, I've got a very temperamental laptop here.
Okay, could you start again, please, Lisa?
Yes,
Thank you.
Rona was very assertive and was able to articulately and calmly explain that she had actually come up with the idea prior.
Right.
Yeah, it is a shame also that in that scene we didn't get to address the sexism bit, but.
Right, excellent. Is there anyone else that noticed anything different, or who could add to that?
She managed to activate her passive female colleague.
Right. Okay. That's a point. Somebody else joined in. She inspired somebody with her assertiveness. Great. Excellent.
She preempted that Speedy Seb was kind of being made a bit of a hero by saying, you know, of course I'll help him join the team. Of course I'm happy to mentor him. So she was like repositioning herself within the team.
Right. And keeping the peace actually as well at the same time, yeah?
Yeah.
Right. Very intelligent. very intelligent. So, has anyone else got anything?
I think
there
she
about
used
the changes.
she used the law to very good effect.
Right.
Talking
Right.
about bringing in the Equality Commission, and that seemed to change the mood.
It did. Should take it up with higher authorities, so to speak.
Yeah.
Brilliant. So what did change then because of all of that?
I saw Ken had his hand up, and then
Oh, Ken,
go ahead,
sorry.
Ken. No, that's okay.
Yeah,
Right.
sorry, I know I said a lot on the other issue, but I mean, I think fundamentally the issue isn't Rona, the issue was Jack. I mean, and it's Jack's behavior that actually needs to change. And what she did was she challenged. She did activate someone else in the team. It's a shame that other people in the team also didn't feel able to speak up and challenge some of that behavior. But in the long term, I think I don't see a big future in that relationship if it continues like that without other intervention happening, either from the wider team or people who are responsible for managing Jack.
Right. Would anybody say it was real? Do things like that actually happen?
I was just going to say, to build on what Ken was saying a bit.
Okay,
and yeah,
sorry.
That's all
Go
right.
on.
Those things certainly do happen. I've been both witness to them and victim of them. And I was going to say that Rona's character was very good at advocating for herself. She was very well informed. However, the character in our scene was already struggling. She already had stuff going on behind the scenes with her mental health. And is it right that the victim should have to be the one that has to be strong? That's
right.
my question.
Right.
Sorry,
So in other words,
I got confused because it was a different actress playing the part to the one that with the mental health issues who was taking notes. So that was a different character.
yeah,
Lisa
it was. It
project
was.
manager. Yeah.
Oh,
You got
sorry,
that right.
you're correct. Sorry, I got
Yeah.
confused. I have to apologize.
Yeah.
But I think the point of having to being assertive and what is the danger to a job, especially in a charity or in the arts sector, especially during COVID, is a really important point. Yeah, go ahead, David, wrap us up. And
Yeah, but could everybody do that? Not everybody could engage. Not everybody has that assertiveness. So what could we do? And maybe it's the institutions or the system that is set up that creates those problems. So maybe we have to address those and work with that. So
can I just say quickly, my trade union did assertiveness skills training for work. My trade union Equity, they do assertiveness skills training. So if everyone joins a trade union, even if it's just a Unite community, there's lots of training available, and the assertiveness skills for work would be one of them.
Brilliant, brilliant. That was fantastic. Thank you, everyone. I'm going to pass you on to Katy to pursue.
I'm going to pass you on to LaToyah, who's going to take us from this incredibly rich conversation to thinking about the kinds of structural interventions we're now starting to imagine, and we are going to make them happen in the next 45 minutes. So go ahead, LaToyah.
Hi everybody, me again. So as you can see from watching the play and also having the opportunity to intervene, we've noticed some structural barriers. So I'm just going to ask Priyanka if you could please share the document where we can look at those barriers.
I'll stick it in the chat for you now.
Okay, great.
You can share the screen if you want, Priyanka, so we can see it. It might be easier just for that document.
I'll share the screen as well.
Yeah, share the screen.
Can you see it?
Yeah, so we've got quite a few. So if we think back to the structural barriers that we identified and some of the policy ideas that you've come up with, we have noticed that we all have the power of creativity and that small things can make big changes. So what I want you to do is think about how you can use your voice to make these changes and think about a policy or a new rule that you might want to propose. So in order to do this, I mean, think again about what you've just seen, what you've learned, and what you've tried, and even lived experiences that are similar to what you've seen in the play. And then when you think about these ideas, these policy ideas that you want to put forward, bear in mind that we have some people here from the council, from the Arts Council, that you could put these policy ideas to. So for the council, for local charities, these ideas can be new rules, they could be resources, they could be ways of implementing existing policies. So this is a chance to be creative. All your ideas are going to be anonymous, so don't worry about that. Just be creative and yeah, think about the ideas that you've seen and the lived experience that you've had. So if you just go to the chat, there's going to be a short form where you can submit these ideas.
So Priyanka, if you will drop that Google form into the chat. This is the only technically tricky part of today, but you can do it, and if you can't, we will help you. There's going to be a link in the chat where you can add one sentence of a proposal that you would like to see, just like LaToyah said. Here's the link. If you go to that link right now.
So if you just write what issue from the play that your idea relates to, so whether it's the scene from the GP scene, the homeless scene, or the scene in the arts institution. And then next to that, if you put your idea that you propose, and then also
oops, Councillor Ward, do you have a question? Are you having trouble finding the?
Yeah, I'm really sorry. Google Docs don't work from council computers.
Oh,
so,
okay. Got it. No worries. If you aren't able to enter in an idea, well, actually, Councillor, you'll be looking at the ideas in a second.
Yeah,
so
that's fine.
Okay, but if you aren't able to enter an idea, you can always enter it into the chat, or in a moment we can do it out loud too. But the easiest way will be if you can enter your sentence into that doc if you are able to. It's a form. It's a really short form. Is everybody? Yeah, go ahead, LaToyah.
I was just gonna say, is anyone else having issues with the Google Doc? Okay, so yeah, just fill in what your issue is, what you propose.
Oh, they're starting to come in. They're starting to come in, LaToyah. It's very exciting. Keep going.
So
keep going.
It could be very small. It could be a small change. It could be about resources, new rules, ways to implement existing policy. So be creative. It's all anonymous. And we're going to put these ideas to the policymakers.
They're coming in. Make sure you press submit when you're done. They're magically showing up for us, and we're all about to look at them and then sort them. This is great. Keep working.
So we've got the mental health scene, homelessness, sexism. What do you propose in those situations that you saw, and also lived experiences? And who would you want to put those ideas to? We've got councillors here.
Great.
Yeah.
All right, so tell us what's going to happen next while they finish.
Okay, so what we're going to do next is we're going to have a little 10-minute break. And while we have that 10-minute break, there's going to be some action going on. We're going to put those ideas to the policymakers, and they're going to be sorting through your ideas, going through it, looking at trying to find the top 3. And the top 3 that they come up with are going to be based on what was most popular and what was most common amongst the ideas that you put forward. So when you come back, these ideas that the policy team have been deliberating over, you have a chance to see their input, put questions to them, and see what the next step will be. And then there'll be a vote. So we've got 10 minutes. If you wanted to, you could also listen in and see what the policymakers are doing. So this is going to be messy.
Yes.
And democracy. It will also be a chance for you to see policy negotiation in real time.
Go ahead. So we are going to have Councillor Lukes and Ken from Help on Your Doorstep are going to work on, I'm just trying to make sure I can find oh, here we go, are going to work on the idea about health and mental health. But you can also look at some other things if they're interesting to you. We will have Councillor Watts and Councillor Ward working on the issue of housing and homelessness in the council. And we will have Alex from the Arts Council, as well as Michael Chandler, working on the cultural sector issues. Does that sound okay, policymakers? So we're going to put you into rooms and we're going to help you with that. And then the main room will be the housing room, so we can all hear that, if that's okay. And if you want to take that break, what time are they back, LaToyah? 4:52?
Yeah, so 10-minute break.
All right. So we are going to open the rooms for our policymakers to sort the ideas. Priyanka, I'm going to put you with Councillor Lukes and Ken Kanu to help with the Google Doc. And Michael, you will be with Alex, and the rest of us will be here in the main room for now. So let's go ahead and do that. So I'm going to share this sheet so that our council members can see it. Here we go. So it's this. Okay. Whew. So let me help you with this. LaToyah, actually, can I, well, you should, hopefully the other groups are going okay. I might put you in, I'll start this off and then I'll go in the other room. Okay, so Councillor Ward and Councillor Watts, you with us and other folks? Yep.
Yeah, we're with you.
Great. So you have this sheet. Can you see it?
Yeah.
Great, and you can minimize the people on the side if you need help, or you can move your screen around. So housing and homelessness support. So I'm highlighting now, whoops. I'm highlighting the ones you can see are relevant to your issue. And your job in the next 9 minutes is to try to turn these into one proposal. Okay? So kind of summarize, find out what's similar, and we'll put the link in there if you are able to open it. But if not, LaToyah or other people who have it open can help if you're having trouble reading anything. I'm just trying to make sure you can see as much as possible while we go. Does that sound okay?
That's great. Thanks, Katy.
All right, here, I'm just opening this up so you can see the full, yeah, all right, great. There you go. That's the whole thing. So go for it. Everything that is in
9 to 18.
There you go. There you go. All right. You're on it.
Thank you.
Yeah,
damn it.
Okay. Hi, Richard. Can we start by we should discount the ones that we already do. So firstly, we do already have a policy of 35% social rent and 15% intermediate on all of our sites in the borough. So we're pretty close to the proposal there of new builds having 40% social housing.
We prioritise or?
The idea.
I'm here to help. I'm here to help. Is Ken here too?
I'm here. I'm here.
Great.
Yeah.
So it can be what you prioritize. It can be what seems similar. There's a lot of ideally what there's a lot of energy around from these ideas. So it could be your priority, but we're trying to also reflect the audience priority. Definitely bring in anything that you feel is innovative or could really, be impactful. Does that sound okay?
Yep, sounds good.
All right, I'm gonna leave again. You've got this. Make sure you write down your final sentence, whatever it is.
Sure.
Okay.
Genuinely affordable housing out of dodgy developers, which I think Islington's probably got amongst the toughest policies if not the toughest policies in the country.
Yeah.
On and stuff like that. But I think, and clearly, we've had this conversation lots. We both think that massively increasing the supply of genuinely affordable homes is critical to this challenge. But it's a long-term solution because it takes, at least 3 years from start to finish to get something built, and so it's not going to help the poor guy in the housing needs officer.
Longer one, given permission to check their behaviour.
How are you doing over here?
We're just going through them now.
Great.
Just trying to work out what they are.
So you've got about 7 minutes, and just I said it was going to be messy, right? This is where it gets messy. You should be sweating at the end. Just make sure you write down your final sentence, whatever that is.
Okay.
Okay. I'll see you later.
Great. Next one is for.
Can you? I'm sharing my screen. Are you able to see?
We can see it, but could you scroll it up a bit so we can see all of them?
Sure.
Thanks.
Yeah, sorry, I realized that yeah, LaToyah, can you make the box wider? Or yeah, beautiful. Yeah. Sorry, I realized that it didn't work when I left.
No worries. Thanks. That's perfect.
That's perfect.
Leave it like that. Yeah.
So I think that there's a whole range then of things. You're right. So there's better support for people in crisis. So we've now got, you know, post kind of the COVID everyone in policy, we've now got the shelter. What I mean, is it worth you talking a bit about some of the stuff we're doing, recognizing some of the issues around effectively the service that people were getting when they walked into the office, what we're doing around that? Because it strikes me that's the area actually we probably need to do. If we could do one thing that changes something most quickly, it might be in that kind of area.
Yeah, and I think you can go ahead, Lindsay.
It's Lindsay. I'm so sorry. I wasn't put in a group, and I just wondered, given that I just wonder if, given that I'm the head of paid service for the staffing, it might be good if I said something about that, if that's all right with my councillor colleagues.
So sorry. Go ahead, please.
Yeah, no, not at all. So I'm sure Councillor Ward and Watts agree with this, but what struck me very much from a staffing perspective is you know, the lack of focus on the individual. So even if we take the context of officers being under pressure and feeling restricted by what they can offer because of housing supply and demand issues, we want very much for our staff to be interfacing with our residents on an individual basis, you know, recognising who they are and what the complexity of the situation they face. So I suppose from my perspective, you know, we've been leading quite a significant piece of change management on making sure that we have honest and transparent conversations with residents. Because my experience, and I think Councillor Ward and Watts would agree with this, is that most residents, when they come to talk about an issue, whether it be homelessness or anything else, they do recognise the complexity of the situation the councils and other statutory services are under, and so they, you know, they themselves have an understanding that actually they're not necessarily going to get all the things that they need in that, you know, that short window of communication. But what they want to understand is what's the reality of the situation and what can we do to move some of the issues that they face on. So from me, I think, you know, when I see the very best practice, it's when they're working with individuals and really focusing on trying to move it on incrementally, move on the issues incrementally, where it's not acceptable to us as a council, and you know, Councillor Wards and Watts and others have raised these issues with me, is where actually we look beyond the individual, we look behind them, and we're not seeing them, you know, in a way that can support them. So, you know, in relation to John, what we could have been doing is being more open and honest, definitely, about the reality of the situation that he was facing, and then talking through, what about tonight, John? What are you going to face tonight, John? You know, how is your well-being, and how has it been, given that you've been street homeless? And we have a huge amount of services in Islington, which I'm sure many of you recognise, but it is that focus on the individual and really thinking through how we connect that individual into the whole plethora of services, statutory services that council runs, non-statutory services that council runs, but also the masses of services that exist across Islington as a whole, including our brilliant VCS. So, you know, that's definitely the kind of focus for me is the chief.
Sorry, Alice, I was studying.
Thank you. Back to you, Dermot.
Yeah, so what Lindsay said. But I think if we're kind of the crux of that is kind of, I suppose, just empower the individual, give them the support they need, and you know, we need to be honest with people about the choices, but then empower them around that choices. We might not be able to give you a permanent council home right now, but we can, you know, we can get you emergency accommodation, and we can talk you through the process of applying for housing benefit and looking at private sector accommodation in the area, through we had a housing first pilot. There's lots of different kind of choices and options that that we can talk through. And as Lindsay says, that's all about having that relationship, having a proper individual relationship with the person themselves, and talking them through what the options are, and then giving the choice back to them of what kind of help works best for them.
So this is great. I'm just going to pop in here. This is great. Thank you so much. So it sounds like there's a lot of agreement about what the council has some agency over between Lindsay and Diarmuid and Richard. So let's look at these proposals. Think about which of these sentences are really reflecting some of the things that you think can be done. And then the task, and I know it's difficult, is to try to come up with one sentence. So what is your summary of what is your proposal, and as specific as actionable as it can be. So if it's about giving people more options and how you engage with people on the front lines, what would be the proposal? And is there anything from these proposals here that we can pick up on? I see provision of literature and resources. So how could the three of you sort of tie some of these things together into one sentence that reflects what you're talking about?
That's a tough one.
Yeah.
Can I ask you a quick question, please?
Well, actually, Ian, if you can hold on 1 minute, we're going to let them take a few more minutes to work, and then we can ask questions. Is that okay?
There's, after the break, Ian, there's going to be an opportunity that will open up. The councillors are going to present their ideas first, and then we're going to open it to the audience. So
thank you, Charlotte. So go ahead. So I know it's a tough one, councillors and Lindsay, but give it a go.
Should I take a stab on this? Because I think quite a lot of stuff about increasing supply of socially rented housing we're doing already. So why don't we, I think the one that comes closest to what we think needs doing is the one about training frontline workers, which is, I think, a kind of summary of what Lindsay talked about, which is that wider process of culture change and getting change in the behaviour of our frontline staff to see problems in the round and what we can do to help, rather than just in gatekeeping people to make sure that our basic legal duties are fulfilled.
Yep, that's a good one to go with.
Great. So how would you anything else you want to add to summarize that, and to add any bit of what else can happen there in terms of actions and action steps?
So what we want to achieve is kind of get to a point where we're not putting up barriers to people. We're giving them back we're advising them, and then kind of empowering them to make the choice. And they can only do that with kind of empathetic and well-trained staff who can help them with it.
Okay, so it's about training staff, just trying to get to the kind of proposal bits. It would be about different kinds of training of staff, which I see in these proposals, training frontline. Were there any specifics about how you think that training would happen, or anything from these ideas that we want to add in?
Well, I think it's far more than just about training. Actually, it's about a whole series of how the organisation is equipped to do that. And I see trauma-based training is in the chat, and I think we're really good at that as a council in our children's services workforce, as we were the first trauma informed council in the country to roll that out training out amongst children's services workers. I don't know, Swan, I should know this, whether that happened amongst housing needs staff as well. So I think trauma sits underneath a lot of demand in the borough, but I do think there's a thing about a broader system of culture change and training for staff that effectively gets them to see people as a whole and look to try to creatively use their strengths to solve problems rather than just legally discharge their duties.
And indeed, as part of that training, why don't we do some legislative theatre with frontline staff? Would that be something we could do as part of that?
I think that's brilliant. But maybe to bring that, Councillor Ward, to kind of expand that. So culture change, which you want to implement by training. I'm just trying to help summarize this into a sentence. We're going to bring this to the whole audience in a moment. And that may be, to your point, either legislative theater or just more generally, like coming from the human experience of people's experience with these services. Does that sound right to you?
Yeah, sounds good.
And then anything else about anything? I mean, I see in here, I'm just looking if there's anything else that we can include. There's
I think there needs to be like on hand advocates available in council offices, not someone you have to book days in advance or someone you have to be referred for, but somebody that's in the council offices to offer ad hoc support to somebody who is struggling to express themselves or being re-traumatized by having to express themselves about their homelessness.
I think that's a really good idea, but it's very resource intensive to have an advocate for every person who comes through the door to the housing needs service. So I think it's a great idea. I'd love to explore that further, but it's a big resource. I think that would need to be teased through quite well.
Okay.
But in a sense, because we've got Groundswell, we've got St Mungo's, got lots of provision, and you know, Dermot's absolutely right. You know, the officers that are in the council offices have got the job to do, but we want them to take the very best of the skill set that advocacy you know, calls upon, and have that embedded in their practice. And we've got something called Fairer Together, which is our all-age multidisciplinary response to emerging and complex need for people, which includes everything from housing and social need right the way through to debt, etc. So I mean, and that's an emerging way of working for us. So in a sense, that's, we've said as a staffing group, you know, we see ourselves as wanting to be the trauma-informed council, not just in children's services, that really understands that any one of our residents, and indeed our staff, could find themselves experiencing any trauma at any point. You can be going on in a, you know, steady state in your life, and then something happens and suddenly the bottom drops out of your world. And actually, as a group of officers delivering, you know, hundreds of services to residents, we want to be able to, you know, draw on a level of skill and resilience within ourselves and across our wider workforce that helps us address some of those issues. I suppose the other flip side of that, and somebody made the really eloquent point earlier about often staff themselves, you know, find themselves in a really invidious position on supply and demand, and so they revert to what they know, which is the rule book. And it's, you know, part of my responsibility in the council as a whole to hold those staff, you know, so that actually they feel empowered. The empowerment works on both sides, so they don't feel that they're in a position where they can't offer that human, empathetic approach to the trauma that they're seeing presented. But equally, they don't find themselves in a position where they overpromise, because that's the other thing we see sometimes. I'll see families go and get advice and they come away with their expectation here. And the reality is the gap between the reality and the expectation isn't quite met. And so that goes back to that point really about those honest conversations. So I think it's something about, you know, adopting the trauma-informed practice in the culture of the interface between, you know, the officer group and our residents, that is truthful and honest, sees that individual, but, you know, works to address the needs of all of those people, whatever they may be. It's a big ask, but it's definitely something we're committed to. And I think, you know, many of the things that we've already invested in kind of illustrate our commitment to that.
Brilliant, brilliant. Thank you so much. So we're back. Everyone's been working hard. The main room has been popping with conversation, and we had Diarmuid Ward and Richard Watts and Lindsay Roberts-Egan. And I'm sorry I didn't name you before, but thank you, all of you, for working on that in this main room, and we were all listening. But we also had 2 other rooms going at the same time, so we should have 3 proposals to work on now and ask a few questions about. And I'm going to pass it to Charlotte. I was just going to say, oh, Councillor Lukes, we were going to start with your proposal. Could we start with your proposal? And if you have to go, you can pass that to Ken. But Charlotte, what do you think? Can we start with health?
Yeah, I think that sounds great. And I just wanted to say thank you for your time deliberating over the break, which wasn't a break for you, so apologies for that. And yes, I'll hand over to Councillor Lukes if you could present the first proposal, please.
And Ken Kanu also, both and either of you. Go for it.
Brilliant.
Can I hand over to Ken, because I do have another meeting to go to. I'm really sorry. I mean, there were just a couple of us in the group, so we kind of pretty well, we put the world to rights fairly effectively between the 2 of us, I think. So,
brilliant. Thank you. That's perfect. Ken can also present it as well. Either or.
Yeah, okay, so I mean, there were a few ideas in here, a lot of them great, some of them required money, some of them were more about just working smarter, but the one that really kind of got us going was about thinking about just better integration between the health sector and the community and the community sector. So there are a number of things that could be achieved within that. Looking at ways in which patients who perhaps might find it difficult to advocate for themselves could get support going into surgeries, going into appointments with people who could advocate them, and that could be people from within the community, either as a formal or an informal role. We really did feel that there was something about culture change. It's about shifting this power dynamic that exists between health professional and patient, and we did feel that the onus was on health professionals to really try and kind of take on those competencies and those skills and that kind of worldview, which is about trying to equalize that power dynamic. And finally, we thought that there was something about trying to do much more community-based mental well-being promotion, trying to make it more the case that people understand how to look after themselves, look after their well-being, and not get into those situations where, you know, they're having to go for acute problems, looking for medication or for therapies. And there are lots of things that we could do better within the community, within our lives, that prevent mental health from deteriorating. So taking a very preventative approach, and that might take some money, but it saves money in the long term.
Okay, thank you for summarising that, Ken. So the question that we have based on that is, what will it take to make one of those things happen, and what might get in the way?
Is that to me as well?
It is, because
Okay.
we're taking notes on all this just to see the strategy that might then have to go into place.
Well, I think it will take some commitment. I mean, I think that there is a lot that is happening in that direction anyway. There's a lot more kind of collaborative thinking across health and other sectors. But I think it will take kind of some real commitment. I think we're talking about primary care networks, we are talking about the clinical commissioning group, to prioritize some real focus around, you know, professional clinicians working in a much more engaged, collaborative way with the community, with community sector organizations, and, you know, perhaps just shifting that paradigm, which is, you come to me for medicine, or you come for me for a prescription, and trying to work in a much more collaborative way. So I think it's will from the commissioners and from the practitioners themselves to work differently.
Can I go ahead?
Oh, Katy.
I was just going to say, this is great, Ken. And before we open it to the audience, or while we're asking everyone else, including the counselors, also to think about this idea, like what would be, you're talking about what it would take, and as you are representing a local charity, right? What would be kind of some of the needs? What would be the first, you know, would it be, as you said, more funding, or would there be kind of an increase in mental health services from local charities? What do you think would be some specifics? And then I see, Councillor Watts after you. Go ahead.
So I think funding, you know, that we could always do with more capacity to work in the community. So my charity, Help on Your Doorstep, we're doing a lot of work with GPs at the moment. We are delivering a social prescribing link worker service for half of the GPs in the borough. But, you know, I think there are things that require money, but there are things that require working just smarter and more sensibly. And I'm a realist, so I know that those things that require money are going to take longer and are harder to do. I do think that sometimes the thinking and the learning goes one way. I do think that the health sector and actually the statutory sector as a whole could learn a lot from the community sector around how trust is built. We don't have the resources that people need. Housing, we don't have, you know, kind of we can't prescribe medicine for people. So our engagement with the community, trust, the quality of the relationships that we build, that's what we rely on. And I think that if those relationships could be replicated within some of these statutory settings where there's a basis of trust, then you would find that, you know, people's outcomes would be a whole lot better.
Okay, so your main proposal really is that you'll work it in terms of how you'll make it happen, is that you'll do more relationship building between the services that will be working with those people. Are we going to go to audience comments in a minute as well, if that's okay?
That's fine. That's fine.
And then we'll ask for like the first action that you might actually take as a commitment.
Okay, you are aware that I am not a counsellor. I work for a charity, so I'm basically saying what I think should happen across the system. Help on Your Doorstep is one small charity, so
no, sorry.
We already work in this way.
It can go to the whole panel. I should have made that a bit clearer, that kind of means the whole panel. This is my first time doing this, so
Mine too.
So we're now going to go to the audience to ask if there's anything in that you think is missing, or if there's anything that concerns you. So in regard to what Ken just said about the way in which they'd like to help people access a better kind of mental health care in the borough.
And I see Councillor Watts with your hand. If you wanna go ahead.
Thanks, Katie. I mean, this has been an issue with the NHS, which is, you know, our greatest national achievement since 1948 when it was set up, which is it's really quite good at treating you when you're ill. It's not good at all at keeping you well in the first place. And effectively that goes to the heart of the challenge with GPs who've got 8 minutes to diagnose a condition and treat and make a prescription for it, which almost certainly is any recognition of mental ill health is therefore a pill. And you know, we know there are a million ways better of treating mental ill health than pills. Pills have their value and their uses, but you know, about isolation, about physical activity, about work, about a whole range of, you know, about inherent, you know, your sense of inherent value in the community, you know, all sorts of things. But all of those take longer than the 8 minutes the GP's got to sort out. And I think for me, the crux of this, but it's not, but I can work on a proposition for it, is effectively that the NHS is entirely geared around trying to fix ill people rather than trying to keep people well. And we spend, and you know, and they've got far more money actually than local councils have, because we've been cut far more than they have.
Yeah, so that's a,
sorry,
go ahead, Charlotte, you go.
No, fine.
I was going to say that's a challenge, and we're thinking about what is also possible within this space. So I think kind of the idea of the local charity sector advocating to build more relationships with the GPs and also increasing their own ability to do mental health promotion, as Ken said, is really brilliant. Yeah, and let's go back to Charlotte's question. If anyone else has any amendments, things to add before we pick up with the next proposal.
Yeah, so this is down to anyone. You can put it ideally in the chat, but if there's not a way for you to do chat, I'll also keep an eye out for hands as well.
Can I just say, oh, am I on mute? Oh, sorry.
No, you're not, you're fine.
Just that I've experienced this in the past, clients have. I think mental health is the, what do you call it, the underdog. I think GPs are much happier treating a broken leg or some physical illness. When it comes to mental health, there's not enough funding for mental health services. And even if you are referred to the crisis team, you can still wait a year before you get to see a therapist. And B, a lot of GPs they're so overworked and overwhelmed at the minute, they don't see mental health as a kind of priority. It's the feeling that I get. It was very good what you did with the typing, because every time I speak to my GP, you can only get phone calls today. It's type. But I do think there needs to be far more resources, because so many people are having mental health issues, especially with lockdown and everything. And there are and a lot of it depends on which borough that you're in. A friend of mine lives in a different borough to me in Haringey, and there's a lot more services available. But I do think mental health at the minute, although there's a lot of talk about it, there's not enough funding for people to get the help that they need unless they can pay to go privately. And I really feel for people, a lot of people suffering at the moment.
Thank you for that, Kay. Those are all like really good points and very important, I think. And I don't know, mental health can't always be prevented. More chronic types of mental health are not preventable, they're disabilities. That's just something that I wanted to add as well. But apparently Martine had her hand up, but after that we'll move on to the next section. Oh, Martine has put it in the chat. I agree with everything Ken says. It's great that a more discursive response was given than a soundbite single solution. Okay, so there's another thing in the chat. GPs also can take a very top-down approach and don't listen to the patient as if they are the person who knows their body. It's true that the relationship is set up on a hierarchical basis, true that appointment times are too short, and also true the focus is fixing ill health. So
let's turn back to, just for the sake of time, let's turn to Ken for one action that you would either like to take or like to see taken by someone here to help move that idea forward.
I mean, I think that, you know, part of the problem is that we still think in silos across the system, is that, and some of that is shifting, some of that is changing. I feel that there is an immense amount of capacity and social capital in the community. And if we could bring that together with clinicians and policymakers thinking about health, etc., and then thinking about how we can work together much more effectively to just design out some of these problems. Yes, it is true that there are some unpreventable issues, but there are doctors, health professionals spend a lot of time with preventable issues. If we could clear those out of the way, then they could spend more time with people who needed it.
Okay, thank you. I think what we're pushing for as well is like one action that is going to be taken after this.
I'm going to suggest, what if we say, Ken, that the first action is some kind of summit or some kind of meeting between the local community sector and the local GPs and mental health providers to share best practices and start sort of building this trust-based collaborative learning, as you say. Does that sound like an action?
That would be fantastic.
Beautiful.
Brilliant.
All right.
Thank you. Thanks so much.
Thank you.
So we're going to move on next. Thank you so much, Ken, for that, and for everyone for sort of debating that together. We're going to move on to Councillor Watts and Councillor Ward to talk through housing.
And Lindsay, and I'm the Chief Exec, Lindsay Roberts-Egan, in this group also.
Brilliant. Okay, sorry about that.
So go. Yeah.
Okay.
Okay, so once again, can one person from your group present the second proposal?
Okay, so we loved pretty much all the proposals, and you could kind of split them into kind of three distinct groups really. One was increasing the supply of social housing, which and particularly abolishing right to buy, so they wouldn't lose those social homes.
Okay, so have you frozen? I can't tell if you've frozen or finished.
He's
I'm
frozen on my screen
assuming
as well.
Dermot's frozen unless he's just trying to troll us. I think so one was about increasing the number of social homes, stopping right to buy, proper amounts of affordable housing from developers. Number 2 was about improving kind of support for people in crisis. So we've actually now got the night shelter people are talking about, which is great news, but it's only happened in the last year with a bit of extra government money because of COVID. Better advice, better support for mental link workers with GPs, better advocacy in offices, that kind of thing. And third is a general sense of training and support amongst staff. So staff knew how to better support people who were undergoing crisis and what we could do to be enabling rather than gatekeeping. And Lindsay, I'm going to ask Lindsay if that's all right to talk a bit about that, because that's the thing we've been doing most work on, and I think is the most important quick win we can make in this area.
So is this something that's in progress at the moment or something you've already done?
It's in progress at the moment, but we really need people's interaction with it in order to get it right, because what matters is how people perceive the service rather than how we think it is.
Okay, so it's still in development and there's still an opportunity to contribute and change it. Thank you, that's brilliant. Lindsay, sorry, you were gonna.
Sorry, Councillor Ward, I don't know if you realise we lost you after about the third word.
Yeah, I'm back. So it seemed that Richard picked up where I left off, so that's okay.
So what I'd be adding to that, colleagues, is that we want to continue to develop a holistic multidisciplinary model working with residents that focuses on the individual, uses and develops the strengths of that individual, services that have open and honest, enabling, trusting conversations. You can see real synergy with what Ken was saying earlier, adult to adult dialogue, and moves issues on, recognising that every contact counts. Because again, across the course of the afternoon, we've seen the frustration of that interface where you're having those conversations, you've got that appointment, and yet your issue as a resident doesn't seem to be moved on. So that's the kind of context in which we're moving that cultural way of operating. And I would say, what we're calling it is Fairer Together, and it is multidisciplinary, it is council services, but it's also other agency services. So again, real read across to what Ken was saying earlier. Thank you. Back to you, Charlotte.
Okay, thanks. So I think you kind of, in terms of our next question, which would be what will it take to make that happen, sounds like you're already making that happen and it's in progress, but you are taking some level of consultation on it still potentially. So in terms of that, what might get in the way of some of this stuff happening?
The cultural piece, I mean, Councillor Ward will definitely talk about the sort of policy and the cultural piece. I think, you use the word consultation. I think the co-design with residents is critical to that. We started this way before COVID, and then COVID comes along, and then that interface that you want to have in that engagement piece is different, isn't it? This is great today, but even better if we were physically together. So that's definitely a challenge in this new way of operating, is how we really get a sense of who we are, because relationships are about eye contact, body language, interfaces, all those sort of things. And I think that's a real challenge for statutory and non-statutory agencies and their residents going forward. So I think that's definitely one barrier. I think the other one is any more crises, things arise, because those sort of cultural changes require quite a lot of energy, don't they? Both physical and emotional energy to bring about cultural shift. Sometimes in crises, we lose sight of that. Ironically, I think COVID has done the opposite. I think it's helped many of the agencies to think, actually, you know what? Sometimes we let barriers such as money or the rule book stand in the way. And actually what COVID has shown is that working in collaboration with the community across a range of agencies, we've actually had more momentum and success, albeit in very tragic circumstances. So I would say, perhaps not a challenge, Charlotte, an opportunity here to think differently and to really push forward on that approach to a holistic way of working.
Yeah, I mean, one thing I just really quickly wanted to add to that though is the issues around digital access. So obviously, if you are co-designing this process, you know, I'm wondering, has that been, you know, the need for some people face-to-face co-design come what may, because there are people that will not ever want to, as well as whether it's not just financial, some people just actually don't want to interact in this way on Zoom. So yeah.
Just chiming in, yeah, 1 or 2 action steps you would like to take on this, and we will move to our 3rd proposal so we can get all 3 in by 5:30. Any of you? This is great.
How about, as an action, we arrange something similar to today's session with some of our frontline housing needs staff? Would that be a good action?
Yeah. So I loved the idea before Councillor Ward was talking about legislative theater or some other way of sort of increasing people's understanding of the human experience in terms of your frontline staff. So arranging something like this for the frontline staff as a first action towards that training. That's a beautiful action. Amazing. All right. Thank you to this issue. We've got some great notes on this. Go ahead, Charlotte, take it away for the last one. Thank you.
Yeah, I was just going to say, I think we still need to open that to the audience, whether anything's missing or concerns you. So as an audience member, if you think there's anything missing from that, or you think anything should be added, still please put it in the chat, because we can take notes on this. So, but yes, we are moving on because of time. Yeah. So the next proposal will be coming from Michael Chandler from Union Chapel, of course, and is it Alex Ward? Sorry, have I got, no, not Alex Ward. Alex from the Arts Council. So if someone would like to present that one, that would be fantastic.
Last idea, and again, the council might have something to support or add here, so go for it. Alex, let me find you.
Hi everyone. We had 6 or 7 suggestions. We tried to pull out a couple of themes and look at, I guess, a couple of recommendations or suggestions. And ours were mostly around gender representation and sexism. And empowerment of staff within organisations. There was a really pertinent one, I think, at the start, which was, could the Arts Council have a policy of 50-50 gender split in trustees, maybe in staff teams? There was a question around support for training and workshops about, was it EID? Sorry, Michael, the abbreviation.
That's the one. Yeah.
Equality, diversity and inclusion, and support for forums for empowering staff to speak out. So I think there's a sort of split here in a way in some of these issues we're addressing. Some of them we're definitely experiencing a culture change at the moment. I should say that I'm a theatre relationship manager, so I'm probably talking more through the lens of someone who works with organisations than a policy maker on this. Yeah. We're definitely interested in encouraging organisations to change the makeup of their boards and staff teams to be more representative across the board, and that of course includes gender. We've supported initiatives and definitely would be open to supporting more initiatives around things like workplace culture, organisations like Tonic Theatre, for example, who are interested in a 50-50 gender split in the canon of plays. Parents in performing arts who look at people with caring responsibilities and the access they have to job opportunities, flexible interview structures, etc. And in terms of empowering staff to speak out, some of you might have heard about the work that the Royal Court did around that when Me Too first came about. And again, there's other programs and initiatives that we've supported by both national portfolio companies and project funded organisations and individuals. So I think I'm not trying to make it sound like we've got there at all, but I think all of these things that came up, it felt like, you know, very fresh to me, things that we've been talking about a lot in our teams and conscious of in some of our decision making when we're balancing priorities around the things that we want to fund.
Okay,
You're going to look for an action from me now.
well, I appreciate that might be difficult, but also not just the action, but also, can you see any obstacles in any of that, like to realistically taking place?
Yeah, I mean, I think that, you know, there's a I don't want to say tension really, because that makes it sound negative, but there's always a question about the degree to which the Arts Council enforces something, and the degree to which we encourage organisations to reach these places of best practice. But I think, you know, we've got a delivery plan that's due to be announced any week now, that sets out our approach over the next 10 years, and that will include things like representation and the kind of policies that we expect organisations to have in place.
So let's just to jump in, let's get to that question about either an action step you could take or that you could propose to your colleagues before we take our final.
And I suppose there's two things I would say. One is that, and I don't know how to form this, so forgive me, but one is that you know, I could easily say that we would love to hold a conversation with people about how we better take these issues into account and give people a chance to frame them in the context of the work that we might support. So that's one thing. You know, we have surgeries, etc., where we support people to apply for funding, and we talk about projects, and we talk about the Arts Council's approach in general. So if there was a sort of theme under which we wanted to hold one of those, we could do. The other thing is that, again, I'm sorry, I don't know what form it takes, but I'm more than happy to go back to colleagues and say, you know, what is it that's holding us back from a 50-50 split? Now, I know there's been conversation about this and some of it public, you know, but I couldn't say what our formed response to that was, other than to say that I think it's that question again of whether we encourage organisations rather than enforce policy.
So pushing,
but that's something I would happily go back with if there was a statement put together that asked that question. I would happily take that back.
Wow, that's great. A public push to the Arts Council to ask why not a 50-50 split, and maybe leading towards some transparency about the answer for that, and holding some kind of forum around this issue of sexism, sexual harassment in arts organizations. I think those are two fantastic actions. So thank you to Alex, and we are going to wrap up in a moment. You are all doing so great. So I'm just gonna take it away for the last few minutes. Thank you, Charlotte, for leading us through this, and we're gonna thank everybody in a moment for this. So we have three meaty proposals, which have multiple parts, and we're just gonna be able to prioritize for a second, just like we did at the beginning, just to get a sense of where we are. So we've got our three proposals, and you can say, if you want to see one of these happen first, I know this is hard, again, it's kind of a trick question, but where is your interest? So we have multiple parts of each of these proposals, and we've got action steps that we wrote down. We've got better training for the health professionals, collaboration between clinics and community-based orgs, and more community-based mental well-being promotion. Around housing and homelessness, culture change in council staff, we had some really specific things, trauma training and support for staff, and to move issues on. And I'm not sure that all my notes made it in there, but you get it. And a 50-50 gender split, in staff teams and trustees from the Arts Council around cultural spaces. And I think that relates to other workplaces too. And could there be support for more training and forums for staff to speak out? You've all been, this is great. Half the people voted. Take a vote. Where are you feeling passionate? Just so we get a sense. And if we end up with equal passion, then we'll just have to do all of them first at the same time, which is also fantastic. Oh, this is great. Almost everyone's voted. I'm going to share the results. Any last votes coming in? All right, here we go. Oh, great. More. This is amazing. Okay, we've got a lot of energy around this. So I'm going to share the results. 45% are really passionate about the issues around council staff that were relating to housing and homelessness in the play, but also 35% are interested in this idea of collaboration in Islington and North London between clinics and community-based orgs, and more community-based mental well-being promotion, I think was the last word. And also 18% are interested in these radical ideas from the Arts Council. So thank you, everybody. Can you give yourselves a round of applause for your proposals and for all of your amazing action steps and creativity? So we just want to do some thank yous. We know we always run out of time, but as we said, I told you at the beginning it was going to be messy, and I kept my word. So, so first, we would like to thank our policymakers from the council, from the Arts Council, from Help on Your Doorstep, who we are going to follow up with about what are your actions that you're going to take. We're going to let you know, and then we're going to let all of us know what happens in the next month and 2 months. If these meetings are scheduled, it's going to be really exciting to find out. So thank you to them. Yes, I see the applause for joining us for this full afternoon. It's so awesome. I love Councillor Ward's idea that we're going to have legislative theater for the staff in the council as part of their training. And thank you to all of you, as I said, for your ideas, for your comments, for your questions, for your interventions on stage, for your patience with us. And particular thank you and a huge round of applause to our actors and facilitators who have done this for the first time, this major superhuman effort of doing a legislative theater event on Zoom, no less. They are incredible. Charlotte, Cristina, Gamze, Detroy, David, LaToyah, Maryam, and who am I missing?
Shasha.
Paul and Shasha for helping out. I think that's all of us. So we will follow up with you, audience, about what came out of this. We hope that you will tweet at Union Chapel UK about how the new proposals and how excited you are. And we hope that you will think about how things like this, to connect our human experience and our collective creativity, can move us forward towards other kinds of structural change and integrate these kinds of ideas further. So yes, please put your love in the chat. We're not signing off yet, but we want to let you go about the rest of your evening. But just let's everyone, you can come off mute and give another big round of applause.
Thank you, everyone.
Thank you. Amazing, amazing. And we hope to see you soon in real life when we do this again. And we will, as I said, we will let you know what happens with the proposals. And that's about it for us. Thank you to Michael. Thank you to Union Chapel. Thank you to Priyanka. Big thank yous to everybody.
Thank you, guys.
Thank you.
Thank you very much.
Very much.
Well done, Katy.
Thank you.
Thanks, everyone. Well done, Katy. Take care.
Thank you, counselors. Thank you, Lindsay. Thank you,
and a big thank you to Katy as well.
Thank
you. Yeah, thank you, Katy.
Yeah, big well done to Katy. Well done, Katy. Well done. Well done, Union Chapel. Well done, guys. Nice to see you, Michael, and Brian, and Charlotte, and Cristina, and David. You guys are great. And Gamze. And
that's right. Now
Laura,
it's 5:36. It can just turn into a love fest now. Please, Bill.
And Detroy.
Thank you.
Thank you, Katy, for taking us through all of this. Thank you so much.
Brilliant.
It was such a wonderful experience.
Yeah.
Yeah.
Absolutely.
And please let the government build more social housing.
Amen.
Yes.
Get the government to build more social housing.